This is Radio EBM.
I would like to go a little bit backwards, a little bit to the very beginning. And my first question would be is what initially motivated you to develop this MRM-based method for C-peptide quantitation? And what gaps in clinical practice or maybe research you were hoping to address?
We was not the first who developed because MRM is kind of routine technique already in mass spec. So what you do, for example, you have protein, you apply the enzyme, and in our case, we had a glucose, breaking down to smaller chunks, and then you quantify these chunks like a peptide for using Q1, Q2, Q3 eventually. So increase the specificity eventually. If you use a triple class, you increase specificity because the reference method that we already had, it's based on the MZ, you just monitor precursor, So, but we try to improve more specificity and to have extra method in our lab. Just when we quantify our calibrators for standardization purpose, we want to be sure that we quantify accurately. And the purpose of that work was just to develop extra methods, For example, we use our methods that we already have here, reference based on the SIM, and then we also apply this auxiliary method, MRM-based. So, and eventually, if you have more methods, it's improve kind of specificity, if it makes sense. So, but the gaps for C-peptides, it's not really widely used for diabetes clinics, And we're running here in our lab, also running patient samples, and we can see, compare, for example, we're running also A1C. A1C is more widely accepted compared to C-peptide and insulin. So the question why it's still not acceptable so widely, it can be a debate again. And one of the things how we see it also can be lack of standardized assays. So if you run your samples in different labs in different clinics, you can get different results depending on the companies who manufacture this assay. So it can be discrepancy, can be 20-30%. It can be one of the obstacles maybe to widely application, because if it's not uniform, it's why it can be. And my hope if with this method we develop more mass spectrometry method, and eventually even maybe some of the methods can be used in the clinical labs, like a big labs who can afford like a so advanced technology. So it's just more wide application first and more kind of, but primary goals for standardization purpose, because this method will be routinely used in our lab for assigning the calibrators. Calibrators is the purpose for standardization purpose.
Right. And I would like just to emphasize for our listeners and for those who are watching this podcast right now that your lab specializes in diabetes diagnostics, and two main avenues have been pursued, like global standardization programs for analytes such as HbA1c, C-peptide, and insulin. And another one is a research in clinical proteomics using mass spec to identify diabetes biomarkers. And in lieu of those kind of two main avenues, your work, this current publication is really important and necessary, I think.